Thank you for joining us today at the COVID-19 media briefing. Today we'll have Mayor Tory and Dr. Eileen de Villa. We'll also have staff on the line to answer some of your questions. Go ahead, Mayor Tory.
Well, thank you, Lavin, and good afternoon. I'm joined here, of course, by our Medical Officer of Health, Dr. Eileen de Villa, and today Dr. de Villa will be speaking to the hard work, the very hard work, and very effective work, I believe, the Toronto Public Health has done and is continuing to do to help support Toronto schools as they prepare for what I think will be a very well-received return to in-class learning. Dr. de Villa, along with the other medical officers of health, have made it clear that they want schools to reopen safely and reopen before other sectors are reopened. Based on the medical advice we have received here in the City of Toronto, I am in full support of the approach taken by Premier Ford and Minister Lecce, including the approach taken with respect to City of Toronto schools in particular. In-class learning is very important. Kids need the social development they get from going to school while being surrounded by teachers and their peers. We all agree as well that this reopening of schools must happen safely. I know everyone, the province, the school board, public health, Toronto Public Health, are working together to make sure that we get it right, because getting it right is extremely important. I'm encouraged by the province's announcement of further funding for PPE for teachers, expansion of testing, and the hiring of more teachers. These are good things that the province is doing, accompanying their announcement of the safe reopening of the schools. These are some of the right things to do. I know Minister Lecce is committed to keeping schools safe. He said this over and over again, and today again he pledged to make sure that they monitor, the Government of Ontario monitors this reopening of the schools very carefully over the coming weeks, and I welcome that as well. The February 16th opening date for Toronto schools has been set with input from Dr. de Villa and recognizes the reality of the virus situation in Toronto, York, and Peel. So I do want to say one more thing, which is very important. And I want to say to all of the students and the parents and the teachers who've been working hard to do the remote learning since the Christmas break, and that's quite a long time, longer, I think, than maybe we expected. I just want to say thank you. I can't say that enough. Thank you for your extraordinary efforts during these tough times, for your patience. I know from hearing about my grandchildren that, doing the jobs that teachers have to do all the time is not an easy job when it's done at home, and parents are trying to work at home, and there are often more than one child trying to do all of this. I want to thank all of those people, the parents and the teachers, and also the kids. Most of them don't watch these news conferences. They're smarter than that. But I want to thank them for their understanding, for the sacrifice which was made in the name of public health and in the name of the well-being of everybody's children. And now I would like to invite Dr. de Villa, who's been such a leader in working with the school board and providing us with advice on this and many other matters throughout the pandemic, to outline the steps now that Toronto Public Health is taking to support the province and our school boards to provide for the safe resumption of in-class learning. Dr. de Villa.
Thank you, Mayor Tory, and good afternoon. First, we'll start off with some of our numbers. Today, I am reporting 444 new cases of COVID-19. 352 people are in hospital, and 80 are in the ICU. I regret to tell you that we are recording 17 more deaths since yesterday. Yesterday, our data reporting was affected as a result of our ongoing technology platform migration to the provincial system. More than 80,000 cases have been transferred, and for the most part, the work is proceeding as expected. Unfortunately, some data was affected in the transfer, and there may be some more yet. However, we expect the project to be completed this week and to return to full reporting next week. The story today is schools. When it comes to the question of opening schools, I am of the belief there is no perfect answer or solution during a pandemic. To reopen, there can only be the rigorous application of best practices. When schools were closed for months in the first part of the pandemic, it was in large part for the same reason almost everything else was closed too. We knew very little bit about COVID-19, how it spread, who was vulnerable to it, how it could be treated, and even if vaccines were possible. Over the past year, the body of knowledge has expanded. On this continent, we learned a lot over the course of last fall about opening and operating schools in a pandemic. Now, the decision to reopen schools has been made. In Toronto, when school returns, there are systems in place provided by the province, the school boards and schools, testing partners, and Toronto Public Health. Toronto Public Health has increased our school response team capacity above what we had last fall to almost 200 staff supporting schools, students, staff, and families. There will be daily screening of staff and students that each school will check each day. If a student or staff has even one mild symptom of COVID-19, they cannot attend school and should go for testing. There are also screening questions so that if someone is sick at home with COVID-19 or isolating at home because they were a close contact of someone with COVID-19, or if someone recently traveled, a student or staff in that home does not attend school. These changes are especially important because of the variants of concern. These are enhanced screening questions to reduce the chance of anyone entering the school with COVID-19. If someone in a school develops COVID-19, investigators do an assessment to determine where the person might have gotten the infection and to whom they could have spread it. We work with many testing partners and assessment centers in the city to provide access to testing of cohorts and sometimes whole schools based on the findings of the investigation. If someone in a cohort tests positive for COVID-19, principals will dismiss the cohort. School principals and vice principals will continue to have weekly webinars with Toronto Public Health to get the most up-to-date information. Toronto Public Health's COVID-19 guidance for reopening schools was revised on January 26th and runs to 21 pages. The protocols for schools are based around mask use by all, active symptom screening, distancing, cohorting, ventilation, cleaning surfaces, and hand hygiene. One update is that masking is now required outdoors where physical distancing cannot be maintained. The guidance is comprehensive and represents the care and attention that is being applied to school operations, with parameters for the information required when reporting cases to Toronto Public Health, the personal protective equipment protocols for staff, even to a recommendation that school pictures not be taken during these current circumstances. The guidance is updated regularly and communicated to schools so they know how they can best protect their staff and students from COVID-19. The arguments in favor of in-class learning have been made at length, but I think where there is debate, it centers on the safety of reopening. At schools, protocols are in place. Awareness and vigilance are high and are key at school and at home. I would say the majority of the public health community and many leading institutions and experts believe schools can return to in-class learning if comprehensive safety protocols are followed. The Hospital for Sick Children published guidance for school operation during the pandemic on January 21st and stated clearly, and I'm quoting, "It is our strong opinion that an in-person school model with robust application of the recommended risk mitigation interventions is the best option from an overall health and learning perspective for children of all ages." The CDC says, and quoting again, "Accumulating data now suggests a path forward to maintain or return primarily or fully to in-person instructional delivery. Actions include taking steps to reduce community transmission and limiting school-related activities such as indoor sports practice or competition that could increase transmission risk." Even the famous Dr. Fauci said in the last week, "It's less likely for a child to get infected in the school setting than if they were just in the community." None of these are endorsements of any specific plan, but an endorsement of the principle that open schools and in-class learning are achievable with the right controls in place and dedication to supporting them. But if we've learned one thing in the last year, it's that none of our actions now take place in isolation. And I want to return to a point in the CDC paper with which I agree wholeheartedly, that actions include taking steps to reduce community transmission. Wherever children are best suited to learn, reopening schools poses a question to us all. What are we willing to do to support the opening and operations of schools for the children and staff who are inside? Exposure risk is driven in large measure by what we do. If we, as a community, are acting in ways to reduce community transmission, we are supporting conditions for our children to learn in safety. So when schools are open, our obligation is to act to reduce transmission. That's our part, play. Keeping apart as much as possible and spending as much of our time as possible at home, only with the people we live with. This means that students go to school and straight home or to before or after care, which means no play dates, no time in the playground with friends, no parents congregating and catching up. All of those out-of-school encounters can increase the spread of the virus. Efforts at distance and all the steps for self-protection, like masking, work. We've seen Toronto taking up the challenge in supporting public health efforts that create distance to diminish spread. This has the benefit of making the city safer for those who have no choice but to leave home for their work which many of us rely on in daily life. It's that easy and it's that difficult because it involves yet another choice and more sacrifice, even if in aid of a good cause. Just as there is no perfect solution for almost anything involving COVID-19, in a pandemic, no action occurs in isolation. Every action must be considered in the context of how it affects the people around us, and with open schools, what we can do to support learning. With that, I'll now turn it over to Lavin, and we'll open the floor for questions.
Thank you, Mayor Tory and Dr. de Villa. We'll now open the floor to questions. As a reminder, it's one question, one follow-up. You will have to unmute yourself when you're called upon. First up, we have Francine from the Toronto Star. Go ahead, Francine.
Good afternoon. Dr. de Villa, how confident are you that schools in Toronto will in fact be able to reopen on February 16th? What metrics are you looking for, and how confident are you that we'll hit those data points?
Well, Francine, I think we have all breathed a sigh of relief and felt better to see our case counts reduce, to see our weekly incidence rates reduce, to see positivity rates within the city reduce. And of course, we're all eager to see our children get back to in-person learning. As I mentioned in my remarks, there are so many reasons for which the public health community and many other educational and pediatric authorities really believe that it is the best thing that we can do for our children. Of course, this is something that needs constant monitoring. We need to constantly observe that which is happening within our community. We know that there are variants of concern associated with increased transmissibility, and that certainly is a reason for ongoing caution and concern. But it's certainly not a reason why we can't proceed with the decision as it has been taken, and why we can't, I think there is, again, a very good rationale, a good reason behind wanting to get our kids back to in-person learning, continue to watch what's happening, and of course, ask all of Toronto to do their part by staying at home as much as possible, minimizing those interactions to the greatest extent possible so that we reduce community spread and create the conditions that allow for the safest operation of our schools.
Follow up, Francine?
Yes, sorry. I wondered if you could elaborate a bit on the masking protocols at the schools that students will be expected to follow. For example, will they have to wear medical grade masks, and are these masks going to be supplied by the school boards, or are families responsible for procuring them?
So Francine, at last read for me, we know that we had stricter protocols here in our schools relative to many other jurisdictions. We had masking for children of all ages, including the youngest, and in fact, we had great success with that. With respect to that which is being provided in terms of personal protective equipment for staff, I'm afraid I'll have to get back to you on that. I don't know the most current available on that. That is within the realm of occupational health and safety. And, my sense is in the conversations that we've had with the province, and certainly the conversations that we've had with our school board partners, there is a real interest in ensuring not only the safe environment and a safe learning environment for children, but of course, the same degree of importance and the same degree of concern is being applied to occupational health and safety conditions and the safety of the environment for staff, teaching staff, and the staff beyond them as well.
Thanks, Francine. Next up, we have Matt from Global. Go ahead, Matt.
Hi, good afternoon. Doctor, can you say what specific details you were looking from the province as far as opening schools went in the city specifically? Are there specific protocols that you called for that were missing in their plan?
Matt, what we have had all throughout our relationship and throughout the operation of schools is ongoing conversation with the province and with our school boards, constantly learning and adapting our approach and our tactics, if you will, within the school based on our learnings. So you have seen that we have adjusted our screening protocols and made sure that we're being as stringent as we possibly can be to prevent COVID-19 from entering the schools, for example. So these are the kinds of measures that we take and actions that we adjust in response to what we actually see on the ground. So you've seen that from us throughout the entire course of the pandemic, and I would suggest to you that you should expect to see that from us at Toronto Public Health on a go-forward basis as well.
And because Dr. Williams has said that the power really is in your hands if you see things that you're not happy with, I'm wondering, just to follow up on Francine's question about specific metrics, if you see something, especially with variants of concern, what level of spread of those VOCs do you see as the red line for schools remaining open or closed?
You know, Matt, I don't know that there is a singular specific level that one can point to in respect of how we would make our decisions. The decisions that we've taken in respect of schools have always been premised on what conditions we're actually seeing. That is just part of the practice of medicine, including public health medicine. What do we actually see? What does our investigation reveal? Are we seeing a number of cases or multiple cohorts, for example, within the context of a school, dismissed? Are we seeing cases where we're uncertain as to what the source of acquisition might be? These are the kinds of circumstances that push us into a certain direction and that suggest to us that further investigation or caution might be required. So that's the approach that we've taken in the past. Absolutely premising our actions on what we're seeing and on the best available science. And as I mentioned, you can expect that from us on a go-forward basis because that's just the practice of good, solid public health medicine.
Thanks, Matt. Next up, we have Jessica from CBC. Go ahead, Jessica.
Good afternoon. So we've gotten a tip about the current severity of the outbreak at Seton House. We want to know if we're looking at, our tip says we're upwards of 27 cases. We want to know if that is correct information. And also, how concerning is this to public health?
Well, certainly we're always concerned about outbreaks in the context of a shelter. We know that residents within a shelter often have a number of chronic illnesses and conditions that make one concerned about the potential impacts of COVID-19. With respect to the specific conditions or circumstances, I'll just check if my colleagues from Shelter Support and Housing Administration are on the line. They may be able to give you better details.
Go ahead, Marianne.
Thank you, Dr. de Villa, and thank you for the question. Yes, as reported by Public Health last week, there was an initial outbreak at Seton House reported last week. We worked very closely with Toronto Public Health and arranged for on-site testing at Seton House. We got those results back yesterday, and there are 20 positive cases of clients at that location. All clients have been transferred to our recovery site, and there is additional testing occurring tomorrow. All of the positive cases are in our hostel program. So tomorrow we will be testing some of the other floors and some of the other programs. It is important to note that at Seton House, it used to have a capacity of over 500 people, and that was reduced to about 200 people very early in the pandemic to ensure that we had appropriate physical distancing. And Seton House is also our program with the most comprehensive clinical support and on-site medical programs. So we're continuing to work very closely with Toronto Public Health. It's not surprising to see an increase of outbreaks in the shelter system, but that's why we respond to them so aggressively, because we want to make sure that we are maintaining as few infections as we can.
Now, just in terms of the number of clients, you did mention it's 20 positive cases among clients, but also staff. How many cases are amongst staff, and what other steps is the city planning to implement to address the issue?
I think that there are, and I'll have to check, there are 6 staff right now that have tested positive. So again, we are continuing to work with Toronto Public Health, doing comprehensive contact tracing. All of the clients have gone to the recovery program. All of the staff have gone home, and we will continue to do on-site testing, monitoring people at that location, and making sure that we're reinforcing all of the current existing protocols, such as screening for clients and staff, all of the additional cleaning protocols, making sure people are wearing masks when they're indoors, all of the various safety precautions that we have had in place for a number of months, and are just making sure that we're very strict on those because we are concerned about the increased transmission rate.
Thank you,
Sorry,
Jessica.
before I go, can I just quickly ask
Just one
the same?
question. Oh, Jessica, it's one question, one follow-up, so we'll have to get to the other reporters.
Yeah, no worries.
Okay, and next up we have Nicole Thompson from the Canadian Press. Go ahead, Nicole.
Hi, I'm wondering if you're able to tell me what the occupancy rate is like for the voluntary isolation center in Toronto.
So I'm afraid I don't have the specific number for today with me, but certainly we have seen an increase in the usage of the Toronto Voluntary Isolation Site over the course of the month of January. And we are seeing that it is getting increased use by clients. And thus far, I have also heard that clients who have had the opportunity to make use of the facilities have been very satisfied with the level of care that they received at the facility.
Dr. de Villa, it's Marianne. I do have the updated numbers for the isolation site for clients from the shelter system. Our capacity is 148, and we had 77 clients there last night. So we continue to have plenty of occupancy at that location, as well as a partnership with Toronto Public Health, should it be needed, to access other recovery sites as well. But we're confident that we continue to have plenty of space up there at the moment.
Thank you so much. And do you anticipate any change once the provincial isolation program and the federal isolation program really kick in?
With respect to the program itself or the offering, my sense is that we will continue to run the Toronto Voluntary Isolation Site. It seems to be that the federal program has its own requirements and its own clients that it's targeting. And certainly we've seen that as people appreciate the value of having a voluntary isolation center, that it is getting increased use and it is serving the needs of clients. So we'll continue to monitor and make sure that we are providing the best service possible for those who actually need that support in terms of effecting a good isolation or a quarantine, as the case may be.
Okay, and last we have Natalie Johnson from CTV. Go ahead, Natalie. You just need to unmute yourself, please.
Hi there, thanks very much. A question for the mayor. I'm curious, sir, we heard Joe Cressy on the floor of council today say that this city is turning the corner on the second wave. Is that how you're feeling as well, as though we're rounding the bend on this latest hump?
I will say yes, that we're rounding the bend, but it's one of those curves on the highway that I think we're all familiar with, that maybe go on for a mile. It's not one that goes on for a few feet. In other words, we're starting to round the bend, because there's no question the numbers have improved. But I pointed out before, the numbers that are present today, while they're much better than they were, say, a month ago, when this lockdown began, are nowhere near what they were at the end of the summer. And so if our objective is to get right down to the point where this is a non-factor in our community, we still have a long way to go. And that includes even when the school's open, because if people are not following the guidelines, for example, adults that live in the house, and the kids are coming home from school and are protected there in all the ways that Dr. de Villa suggested, and then their parents or others are, not following the rules and are socializing with other people, inviting other people into the house, not wearing a mask, we will be in all kinds of trouble. So we have to stay the course. And the reopening of schools is a priority. It's an important priority. It's being done safely, but we have to stay the course on all the other measures, because we're on a long, curve that's going in the right place. But it's one of those ones that, takes a while to get around, and we're making progress, but we're not there.
Follow up?
Thanks, that's good for me.
Okay, thanks everybody. Have a great night. And the next media avail will be on Monday. So see you then.